Hi, everyone. I'm Dr. Holly German. I am excited to be here today answering some questions from the Facebook group. Um, I'm going to try to do a kind of rapid fire approach today. And I usually like to be a little more long-winded. I like to do a lot of education. That's part of my whole naturopathic background, is to really have patients understand what's going on with them and answer questions really thoroughly. I'm hoping to do that, but also be concise because we've had a lot of questions come in, and I just want to try to help as many of you as I can. So I'm going to just dive in. First, we have a question from Michelle, and the question is, well, it's a two-part question. So will it ever end? And do adrenal issues and Hashimoto's go hand in hand? First, I want to say, I hear you're suffering here, Michelle, and I'm glad you reached out. I think, will it ever end? The short answer is yes, absolutely. I think you're on the right track and in the right place. Adrenal fatigue is not something that is irreversible. So absolutely, you can find some answers and take some steps towards feeling better. It sounds like you have Hashimoto's, or perhaps you're trying to find out if you have Hashimoto's. And for those of you that don't know, Hashimoto's is a version of hypothyroidism, where it's an autoimmune condition and the immune cells in the body actually attack the thyroid gland. They're definitely related. I don't know that I would say they go hand in hand, but oftentimes the patients that I see with Hashimoto's or with hypothyroidism also have some adrenal issues. And the reason, and I think this makes so much sense, but in the conventional medical world and with conventional endocrinologists, they don't necessarily make the connection. But just because adrenals and thyroid are different glands doesn't mean they're not connected, right? So all of the chemicals and hormones that those glands make are circulating in the same bloodstream. I see a lot of patients with thyroid and adrenal conditions, and it's one of those things where the thyroid patients will come in, they'll have great lab numbers, their conventional doctors will say, they should feel fine, and they often don't. And usually that is because the adrenal piece of the puzzle is not addressed. So Michelle, I think if you've got Hashimoto's and you're feeling worn out and you're feeling like your symptoms really aren't well managed, maybe you are on thyroid medication, I would say certainly try to work with someone that can help with the adrenal side of things too, because you won't feel better until your whole endocrine system is addressed. So I'm glad you're getting to start with that. Okay, moving on to number 2, I'm going to go with, let's see, Rugmani, I believe is how you pronounce your name. So the question is, why do I experience stress when everything in my life is going perfect? Why am I not able to laugh well? Such a good question, and such a big question is just what is stress? How do we perceive what is stressful? And I would say it's really not about exactly what's going on in your life. A lot of it is about the way we're perceiving what's happening in our stress. I think Angela is a great resource to talk more with about this kind of thing, just kind of reframing situations that might be not helping with you feeling more happiness. I also think some of it may be biochemical. So we know that things like depression and anxiety, if you have those symptoms, it's often easy to find things to be depressed about or to be anxious about. But sometimes it starts with the body's biochemistry telling us there's something to be sad about, so try to find it. Or there's something to be anxious about, so try to find it. And so I would think about, if you're feeling stressed, if you're feeling like you're very easily going into a stress response, but you can kind of evaluate what's happening in your life and you really don't find anything that's contributing to it that way, I would think about, well, maybe it is biochemical for you, and maybe you've got an imbalance with the stress hormones, and there's a number of those. On here we talk a lot about cortisol and adrenaline, but there are a lot of other chemicals and neurotransmitters in our body that affect how we feel emotionally. And so I'm thinking about Things like serotonin and dopamine are some big ones that most people have heard of. So it might be that the overall balance of all of those body chemicals aren't working in your favor to make you feel more happy and to help with the stress and anxiety that you're experiencing. So not a lot of tips there on how to deal with it, but just to give you some reassurance that it sounds like the next thing to do would be to kind of dig deeper and look for perhaps some underlying biochemical causes. Sometimes you can find patterns where it may be with hormonal shifts, like with PMS, for example. You might feel like you have more anxiety or stress, and that's a great clue. That could mean that you tend to have lower serotonin levels, or even lower progesterone levels, which can also happen premenstrually. So I hope that answers your question. It does in my mind. I'll let you know if I think of anything else that would help with that, and I can try to get more specific with it. There are one thing that just came to mind was some herbs that could be helpful for you, and one of them is called lemon balm, which is a really gentle but very relaxing herb, and it's known to cause a more sunny outlook or bring about a more sunny outlook in people who take it. So you can take lemon balm as a tea. That's how I like to take it, and it tastes pretty good too. So maybe start there. Okay, one question. So this isn't phrased as a question. This comes in from Jennifer. And I think the general gist of the question is, what's the best way to test for hormones? And Jennifer says she has Addison's disease. So Addison's is, I think you probably know this, Jennifer, but for everyone else, Addison's is different than adrenal fatigue, which is mostly what we talk about here. Addison's is considered a disease and is actually recognized by conventional endocrinologists. And it's when there's not enough cortisol production by the adrenal glands. So there are types of adrenal fatigue that can have a similar presentation, but it's generally just not as extreme as Addison's is. So with Addison's, it does make things a little bit more complicated, and you'd want to check hormones with a couple different systems. So one, hopefully you're working with an endocrinologist who's kind of monitoring your levels through blood. That's what most conventional endocrinologists will do, is blood testing. So I would expect them to be checking your cortisol levels, perhaps your DHEA levels. Sometimes they'll do sex hormones as well. Maybe not. It kind of depends on the doctor. But if you're working with endocrinologists and probably taking cortisol, I would assume, but you're still having symptoms and maybe you have some other hormonal imbalances that you're struggling with and not getting relief from, I would consider doing more holistic kinds of hormone testing. And I'd probably start with something like what's called a Dutch test, which is a dried urine test for hormones, where you can test your different cortisol metabolites and then also the sex hormones. So things like estrogen, progesterone, testosterone. There's a few different ways on there to look for certain nutrient tests and levels and things like that. And I believe there's a link to that through the Heal Your Adrenal Fatigue website, and I will see if we can post that below where we post this video, so you can have a little more info to read up on there. Okay, let's see. I think I'm gonna try to do two more here. So next one is, who's this from? Sorry guys, just a sec. Lisa. Okay, Lisa. So I'm having night sweats from 5 p.m. to 5 a.m. They're ruining my life. I need them to stop. Yeah, night sweats all night. That would be a quality of life issue there for sure. So Lisa, I don't see here where how old you are, or if perhaps you're going through perimenopause or menopause. That's a common time that people reach out for help, because oftentimes adrenal fatigue issues will come on really strong when women are going through the menopausal transition. And that can start 10 years before actual menopause, which is the cessation of periods for a year. But perimenopause can actually be, starting closer to age 40. So it can last for quite a while. Sometimes night sweats happen in younger women too, and can indicate that there's some other hormone imbalances. So this answer is hard to make super concise because I don't know the answer to those questions. But I would say if you are in the perimenopausal range, a great and easy thing to start with is some herbs. And these could also be safe for women that aren't in that category, but that are struggling with night sweats, but they can affect things like birth control effectiveness and things like that. So you'd want to check with whatever practitioner you're working with to make sure they're safe for you. But one pretty reliable herb for night sweats, we'll say a couple. So one is maca, can be really good. Oftentimes night sweats are from lower estrogen, sometimes low progesterone. And maca is a pretty gentle herb that can support those. And it's also really good for adrenal fatigue. So a few different mechanisms of action. So it's a nice single herb that you can use. And another herb that can help, especially for the perimenopausal night sweats, it's called dong quai. Trying to think of dong quai is, I believe, the most common name. I sometimes get the Latin names and the common names jumbled up in my mind, but that's one that you can find at any good herbal shop. And with any herbs, you want to get good quality ones, and we'll put some brands in the links as well. So hopefully that helps and at least gives you a place to start, Lisa. Okay, I'm going to do one more here. So the question comes in from Victoria, and it's, what are the tests that can be done to see if you have it? So I'm assuming you mean see if you have adrenal fatigue. So I've already mentioned with Jennifer's question, the Dutch test, and that's one way to tell if you have adrenal fatigue. What you want is what's called a 4-spot cortisol test. So it's looking at your cortisol levels at 4 different times throughout the day. So it's usually first waking or early morning, and then mid-morning, then afternoon, and then usually at night, what would be like before bedtime. And so what you're trying to see there is the cortisol curve throughout the day. So doing a one-time blood test doesn't give you enough information to tell if you have adrenal fatigue. The Dutch test also tests other hormones that are affected by the adrenals, so it's the most comprehensive way to do that. And then there are some saliva tests. I use a company called BioHealth also that can look at the adrenal hormones and sex hormones, and it's a little less comprehensive, but still valuable. Okay, I think that's all I have time for today. I hope this was helpful to you all. Again, my name is Dr. Holly German. I'm a naturopathic doctor, and I specialize in adrenal fatigue amongst other hormone imbalances. So I'm available. If you have any other questions, please post them, and we'll do our best to answer them for you. Okay, thanks a lot.